ashver.com.
Hello and welcome to ashver.com. You are watching an interesting video on elimination disorders, tic disorders and disruptive behavior disorders in children.
Please read the disclaimer carefully.
These are of two types. Enuresis concerned with involuntary passage of urine at an age where control should be achieved, or encaprices, which means involuntary fecal soiling at an age beyond which continence should be there. Generally urinary continence should be achieved by 3 years and bowel control by about 4 years. Enuresis. This can occur during the night, most common, or during the day or both. The cause could be medical, due to spinal cord abnormalities, diabetes, seizures, or psychological, due to emotional upset. Sometimes the child may have never achieved bladder control, while in other cases bladder control is achieved for a few months but then bedwetting occurs. Encaprices. The child may refuse to use the toilet, or too much parental pressure may force the child to retaliate by refusing to pass stools in the toilet but pass them elsewhere, like in the clothes or in the room. Or the child may be willing to pass stools at home but not in school due to the change of toilets. Encaprices may be associated with abdominal pain, constipation, anal abnormalities, or may even be a consequence of sexual abuse. In most cases, no medical basis is found. In both cases, positive reinforcement, rewarding good toilet habits and resisting from putting pressure on the child work well. The parents and a doctor whom the child trusts should work together, and the prognosis is generally favorable. Tics are involuntary movements of the eyes, fingers, shoulders or feet, or sounds that a person cannot control and usually manifest in childhood. Tics can be controlled for a little while but ultimately they will come out. An example of a tic disorder is Tourette's syndrome. This is a neurological condition in which a person has 2 tics related to movement and 1 related to sound. It can be blamed on genes and may cause considerable psychological distress to a child, as he may be ridiculed in school or called names like weirdo. Medication can be given to control the tics, but psychological counseling is also important to build up the self-esteem of a child and enable him to interact with his peers without. The name is self-explanatory and includes oppositional defiant disorder, ODD, and conduct disorder. These disorders are more prevalent in boys and are more commonly observed in urban areas. Family discord, absent or indifferent parenting, and absence of a loving home environment are noted in children with disruptive behavior problems. About oppositional defiant disorder, it is characterized by hostility, irritability and temper tantrums. The child is uncooperative and shows this behavior not only to authority figures like their parents but also towards siblings and friends. There is often a family history of substance abuse, mood disorders or behavioral problems. Depression, anxiety or ADHD may coexist. About conduct disorder, this can be viewed as a more serious form of ODD, and the child may threaten to do harm or actually be aggressive at home or in school. The child may steal or bully other children. The child may feel that everyone is against him and thinks negatively about people and situation. Both disorders are treated with cognitive behavior therapy along with family counseling and reworking social skills. Coexisting psychiatric conditions should be identified and treated. These disorders, if they go untreated, may lead to delinquents or thieves in adulthood. Conduct disorder is more difficult to treat than ODD. Thank you for watching this interesting and informative video. This channel offers motivational, inspirational, valuable and informative videos to soothe, cleanse and inspire your health, mind, body and spirit. You can find a lot of interesting videos on wide range of topics here. Stay tuned and keep watching.